Dr. Rahul Gupta is the director of the White House Office of National Drug Control Policy. In this conversation with Lalit K. Jha, he discusses battling drug overdose epidemic in the US. This is a New India Abroad video.
Thank you for doing this. So can we start with the launch of the campaign today, what this is about and why we are launching it?
Certainly. It was very important to President Biden, and in his State of the Union this year, he talked about and he announced a national campaign to educate young people on the dangers of fentanyl and how naloxone, the antidote, can save lives. So we know from the data that less than half of the young people in this country really know or understand that fentanyl, a dangerous drug that can kill them, is in their drug supply. But if you look at it from a pandemic standpoint, so much has changed. Which drugs are out in the market has changed, how people acquire drugs, and what are those drugs has changed. So young people often now go to the social media app and will order drugs like Xanax or Adderall on their social media app, and in fact will end up getting fentanyl, a drug that is 50 to 100 times more potent than morphine, and die because of the poisoning. So what we want to do is we want to meet young people where they are through social media with trusted messengers to tell them this information, share with them, and the fact that they can also have the tools in their toolbox to be able to save lives. So carrying naloxone or Narcan, which is an antidote for opioids like fentanyl, it's important for them to be carrying it because they could be saving the life of themselves, but also of their friends, the neighbors, somebody at school or at work. So it's really important for us to be telling young people that you are empowered and have the ability to save other people's life and carry naloxone with you, because we don't know next time who is going to be going through the poisoning. We're also adding to the social media work and these messengers, digital ads that will be displayed in certain states, in places like subway stations, college malls, grocery stores, and other places, and colleges, to make sure that we meet young people where they are and share this important message, which can often be and potentially life-saving.
Thank you. Can you tell us how serious this situation is amongst the Indian American ethnic community and how you're planning to target them?
Well, we know that if you look at the data in the last few years, the increase in drug overdoses among young adults have increased by 100%. And when you look at fentanyl in particular, it has increased by almost 200%. And when we see young people dying 4 out of 5 times, it is fentanyl that's found, opioids. I come across Indian American communities that their kids have also been impacted by this. So this is a challenge, is one of young people. It doesn't care for who you are, rich or poor, urban or rural, black, brown or white. It pervades throughout communities. And I've seen this in the Indian American community, that it has taken the toll and has taken lives of young children as well as young adults. So it's really important that we spread this message and make sure that, what can parents do? I often say, as a parent, parents can have those conversations at the dinner table. They can also monitor if there's any sudden or extreme changes in behavior of their children. For example, sleeping pattern changes, dietary pattern changes, social engagements change, or maybe performance academically in schools is changed. These are often signs that young people may be going through not only substance use, drug use, but also mental health challenges, because we know that up to 40% of young adults who die of overdose or poisoning also have mental health challenges. So it's important for parents to be engaged actively in the care and sharing and working as partners to not only talk about this with young people, but also encourage carrying of naloxone, an antidote that can potentially save lives.
This is not only US problem but international problem as well. In what way US and other countries who are impacted by it can collaborate on meeting this challenge?
We were just recently in Vienna at the United Nations Commission on Narcotic Drugs. And I provided the national statement for the United States to all of the countries that were there. And when we had our bilateral meeting with countries, as well as group meetings, multilateral fora, here's what we said. We said, listen, today, synthetic drugs like fentanyl, methamphetamine, ketamine, Captagon, these are global threats. Today, you can divide the whole world up into three types of countries: those that have a problem and know about it, like United States; those that have synthetic problems but yet don't know about it; and those countries that are going to have a problem in the near future. So nobody is immune. No country is immune. And therefore, the United States called for all countries to come together to form a global coalition against synthetic drugs so we can work together. And we've had great cooperation from countries like India, Mexico, United Kingdom, Australia, as well as European Union, and many others. We've had conversations with countries like Mexico and Colombia, as well as Brazil, including Kenya and Nigeria. There's so many countries that are wanting and willing to step up and help play an important role of a global leader in addressing this crisis. This is affecting so many countries and so many people across the globe.
As the two largest democracies of the world, how do you see India and US collaborating on this in this field?
We think, as Prime Minister Modi has called India as the pharmacy of the world. It has a large pharmaceutical and chemical industry. India has been very enthusiastic working with the United States to address this because it understands the significance at a global level of leadership and acting as that global leader when it comes to addressing the threat of synthetic drugs, as well as ensuring beyond its impact on healthcare, including mental health. So there is a robust working relationship between the United States and India on this. There's a lot of work going on, including bilateral working relationship around synthetic drugs, but also mental health, as well as pharmaceutical arena, including diversion prevention. And we're very excited about that relationship. We're looking forward to furthering our bilateral relationship and strengthening it, because we know that India can and will and is playing the role of a global leader in this area.
Any specific asks from the Indian government?
What we are working on right now from United States and Indian government is to make sure that we are both looking at our scheduling regimes. How do we schedule controlled substances? We're working together to counteract the drug supply routes and networking, as well as prevention of the diversion of these chemicals, oftentimes that are then shipped to other countries and used in the production of these deadly drugs. So some of these aspects, and we're also working together to see how we can, as both countries, work on issues like addiction, treatment expansion, creation of that infrastructure, as well as mental health, the overlap that happens with mental health and addiction. So there's a lot of work, but at the same time, we're excited about the enthusiasm and the ability for both countries to partner on this very important topic, and something of a role that both the United States and India can play to set examples as model nations for the world.
I know you have other interviews lined up as well after this. One last question. What would be your message to the youths of this country, and if you have anything for the Indian American youths?
Well, the simple message is this. It is no longer safe to purchase drugs, no matter what you think they are, online via social media. Make sure that when you need help, whether it's in the area of mental health, whether you're feeling anxious, alone, depressed, or you feel like you need help, reach out to somebody who's a trusted person for you. Find your parents or others in the community that can help you walk through those challenges. Do not, please, it is important to not rely on these drugs that you can purchase on social media and become potentially deadly. At the same time, look at carrying naloxone, the antidote. It is available without prescription in almost all 50 states. There is enormous amount of resources that are going on from the federal government, and there's a commitment of President Biden to ensure that those resources are provided, especially to help save lives for young people. So make sure you can carry naloxone with you. You can save your life or someone else's life. So it's important to both be aware of counterfeit pills and drugs purchased online, but at the same time, think about and talk to your parents and others about carrying naloxone, safe drug that can reverse a life and save a life, somebody's life, at a moment's notice.
Thank you so much. Thanks a lot. It's been a pleasure talking to you and hoping to see you soon.
Thank you, Alici.
Thanks. Thanks.
Take care.
Yeah.
Bye-bye.
Thank you.
Thanks, Alex. Thanks. Bye.
Appreciate it.